Hello everyone. Today, we're diving into the world of a medication called Junel 1. May 30th, known generically as norethindrone acetate and ethinyl estradiol. As with all our discussions, this is meant for educational purposes. If you have health-related questions or concerns, always reach out to a medical professional. Description: Junel January 5, 30 is a combination oral contraceptive pill that contains two hormones, norethindrone acetate, a progestin, and ethinyl estradiol, an estrogen. This medication is primarily prescribed to prevent pregnancy. It works by inhibiting ovulation, altering the cervical mucus to make it harder for sperm to reach the egg, and changing the lining of the uterus to prevent attachment of a fertilized egg. Apart from its primary use as a contraceptive, Junel January 5, 30 can also help regulate menstrual cycles, reduce menstrual bleeding and pain, and decrease the risk of ovarian cysts. Warnings: Junel 1.5/30 comes with several precautions. It's not recommended for women who smoke and are over 35 years old due to the increased risk of serious cardiovascular side effects such as blood clots, stroke, and heart attack. Women with a history of blood clots, certain types of cancers, liver disease, or unexplained vaginal bleeding should avoid this medication. Additionally, it's not suitable for women who are pregnant or who have had a recent major surgery requiring long periods of immobility. Before taking this medicine. Before starting Junel January 5, 30, it's crucial to discuss your full medical history with your healthcare provider. Inform your doctor if you have any of the following conditions: a history of blood clots or stroke, heart or liver disease, high blood pressure, severe migraines, breast cancer or other hormone-sensitive cancers, diabetes, high cholesterol or triglycerides, unexplained vaginal bleeding. Additionally, let your doctor know if you are pregnant, planning to become pregnant, or breastfeeding. It's also important to mention all other medications, supplements, and herbal products you're currently taking to avoid potential interactions. Side effects: like all medications, Junel January 5, 30 can cause side effects. Common side effects include nausea, vomiting, headache, bloating, breast tenderness, and changes in weight or appetite. Some women may experience changes in their menstrual periods, such as spotting or missed periods. More serious side effects, though rare, include blood clots, stroke, heart attack, high blood pressure, liver problems, and severe allergic reactions. Symptoms of a serious allergic reaction include rash, itching, swelling, especially of the face/tongue/throat, severe dizziness, and trouble breathing. Seek medical attention immediately if you experience any of these symptoms. Interactions: Junel January 5, 30 may interact with other medications, potentially reducing its effectiveness or increasing the risk of side effects. Drugs that can interact with Junel January 5, 30 include certain antibiotics, anticonvulsants, HIV medications, and herbal supplements such as St. John's wort. Always inform your healthcare provider about all medications and supplements you are taking. Dosage: it's essential to take Junel January 5, 30 exactly as prescribed by your healthcare provider. Typically, one tablet is taken daily at the same time each day. Follow the instructions on your prescription label, and do not skip doses or stop taking the medication without consulting your doctor. If you miss a dose, refer to the patient information leaflet or consult your healthcare provider for instructions on what to do next. Avoid: while taking Junel January 5, 30, it's advisable to avoid smoking, as it can significantly increase the risk of serious cardiovascular side effects. Limit alcohol consumption, as it can exacerbate certain side effects. Additionally, be cautious when using other medications that may interact with Junel 1. May 30th. FAQ: many wonder about the age restrictions for Junel 1. May 30th. It is generally prescribed for women of reproductive age but is not recommended for use in children or adolescents who have not yet started menstruating. For specific queries related to this medication, always consult with a healthcare provider. Closing: that wraps up our overview of Junel 1. May 30th. Remember, this information aims to educate and should not replace professional medical advice. Always consult with a healthcare provider for any questions or concerns. Thank you for tuning in.